am assistant professor in MG Medical College, MY Hospital, Indore, Madhya Pradesh in India. Next slide, please. Yeah. So the normal phonatory phenomenon requires a proper structure, physiology, coordination, and efficiency of the larynx. Term dysphonia is often used interchangeably with hoarseness. However, this terminology is not precise, as the hoarseness is the symptom of a change in voice quality reported by the patients, while dysphonia indicates impairment of the voice quality as recognized by a clinician. The most widely accepted and predominant cause of hoarseness is benign lesions of vocal folds, which affect the vibratory vocal fold function and hence cause dysphonia. Next, please. So the treatment for such lesions included a combination of the microlaryngeal surgery, voice therapy, low-dose steroid therapy, and the lifestyle modifications. The holistic voice therapy is based on a continuum of the voice wellness from a disordered to an elite voice. These all include three subsystems of the voice production: respiration, phonation, and resonance. So we include the vocal function exercise in the holistic therapy, which includes they are believed to balance and re-strengthen the laryngeal musculature, improve the flexibility and movements of the vocal folds, and rebalance the airflow. So the voice assessment is an important part of examination for the laryngeal pathology. Various methods of both subjective and objective analysis are used. The simplest are the maximum phonation time, MPT, and the S by Z score. Next slide, please. So maximum phonation time is measured by asking the patient to inhale as deeply as possible and then sustain a steady vowel like A or A as in far for as long as possible. The longest of the three repeated measurements is taken. Values less than 10 seconds are taken as pathological. It gives a rough indication of the respiratory support and the phonatory function. It is advantageous being non-invasive and a quick test. S by Z score is the ratio of the maximum sustained time for a speaker to maintain both an S and Z sound. A normal speaker can usually maintain both equally and voiced consonant, giving a ratio of 1:1. Abnormality which interfere with the vocal fold vibration or which affect the glottic closure, they reduce the Z value, but they don't significantly affect the S time, thus increasing the ratio. So this simple test is used quite widely in our practice. The dysphonic patients with laryngeal pathology usually have the S by Z ratio more than 1.4. Next slide, please. So we also use the VRQOL questionnaire, which consists of the 10 statements on the voice-related characteristics across the emotional, physical, and the functional domains. The patients, they respond according to the suitability or the closeness of the each point, ranging from 1 to 5, 1 being no problem and 5 being the problem as bad as it can be. So we range it from the 10 to 15 being excellent, 16 to 20 very good, 21 to 25 good, 26 to 30 fair, and scores more than 30 and up to 50 is poor. Next slide. So objective of our study was the use of video stroboscopy for the early detection and identification of the benign vocal fold lesions, analysis of the voice for understanding the severity of the voice disorders, and follow-up and the assessment of results in terms of the video stroboscopic and the voice assessment parameters. Next slide. So this study was a prospective study conducted at our center from October 2018 to March 2020. We selected 85 patients in the age group of 18 to 60 years with the complaints of hoarseness of voice and in whom the benign vocal fold lesions were observed on indirect laryngoscopy or video stroboscopy. Next slide. Next slide, please. Exclusion criteria included the known cases of TB, another and with the response to VRQOL questionnaire. After the proper evaluation, they underwent the treatment, which included a combination of the microlaryngeal surgery, voice therapy, including the inhibitors, and lifestyle changes like mental cases with vocal polyps and leukoplakia. Next slide. Specimen was sent for histopathological analysis. Each case was taught and encouraged to do the vocal fold exercise even following the cure of the lesion. Post-therapy analysis was done after 2 months of the treatment using the video stroboscopy, voice analysis, and the response to the questionnaire was noted. And data was compiled in the Excel sheet and pair t-test was done. And happily, all the tests came to be significant with the p-value less than 0.05. Next slide. So this is a picture of the pre-op of a patient of vocal fold polyp. Next slide, please. This patient underwent the microlaryngeal surgery under cold knife. So this is the pre-op video laryngoscopy. The video shows the pre-op and also the post-op. So this is the pre-op picture of the left vocal cord polyp. This is the video stroboscopy. And after undergoing the cold knife microlaryngeal surgery, this was the status of the left vocal cord. And the patient underwent vocal fold exercises, speech therapy, and vocal fold hygiene. Next slide. So,
मेरा नाम मिथिलेश शुक्ला है। मेरी उम्र 50 वर्ष है। मैं पन्ना का रहने वाला हूँ। 1 2 3 4 5 6 7 8 9 10
in the post-op.
मेरा नाम मिथिलेश शुक्ला है। मेरी उम्र 50 वर्ष है। पन्ना का मैं रहने वाला हूँ। 1 2 3 4 5 6 7 8 9 10 जा
Yeah, the next slide.
मेरा नाम मिथिलेश शुक्ला है।
मेरा नाम मिथिलेश शुक्ला है। मेरी उम्र 50 वर्ष है। पन्ना का मैं रहने वाला हूँ। 1 2 3 4 5 6 7 8 9 10
I guess we can move to the next slide, please. Yeah. So based on the Stempel's principles of the holistic approach, we advise the vocal fold exercises. They are a series of the 4 exercises. They have to be practiced at home 2 times each, twice per day, preferably morning and evening. They include first the warm-up exercise. We have to sustain the I vowel for as long as possible on a musical note above the middle for the females and boys, F below the middle for adult males. They may be changed as per the needs of the patient. So based on the airflow volume, when the airflow measures are not available, the goal is to equal to the longest S that the case can sustain. The stretching exercise, glide from the lowest note to the highest possible note on the word null, and the objective is there should be no voice break. Contracting exercise include gliding from the highest note up to the lowest note on the word null. There should be no voice breaks. Next slide. And the low impact auditory power exercise, we have to sustain the musical notes C, D, E, F, G for as long as possible on the word null minus the N, middle C for the females and boys, and octave below the middle for males. So the goal is the same as for the exercise number 1. So the tone quality was monitored for the voice breaks and the breathiness. All exercises were to be performed as softly as possible. The cases were asked to plot their weekly program on the graphs given. The program usually lasted for 6 to 8 weeks. When the patient reached the predetermined therapy goal and the voice quality improvement was observed, then a tapering therapy was recommended. Next slide, please. So out of the total 85 cases, 53 were males and 32 females with a male is to female ratio 1.65. Most of the cases were of the young patients, 31 to 40 years of age group. A positive history of vocal abuse was found in 62 cases and 42 cases were smokers. Symptoms of laryngopharyngeal reflux were found in 53 cases. Next slide, please. A variety of the vocal fold lesions were observed on stroboscopy, with vocal fold nodules being the most common, followed by polyps, vocal fold leukoplakia. Least commonly observed were the vocal fold erythema, Ringke's edema, and papilloma. Most common site of lesion in our study was anterior 1/3 with 54 cases, followed by diffuse involvement and the middle third in the 13 cases. Least affected site was the posterior third. Next slide, please. So these are the picture of the vocal fold polyp. In the open face, it looked like this. In the closed face on the video stroboscopy, it was like this. And this, the third picture is of the left vocal fold cyst. Next slide, please. Yeah, so the maximum phonation time was enhanced from a mean of 8.2 seconds to a mean of 17.5 after the treatment. It was significant. Similarly, there was a significant improvement in the S by Z score from 1.61 to 1.25. And in the subjective rating by the questionnaire, the pre-treatment value was 32.85, which improved to 22. All these values were significant. Next slide, please. So this is the setup of the video stroboscopic assessment. Next slide, please. This is the short video of the video stroboscopy. The patient has the bilateral vocal fold nodules. So here we observe the symmetry, the periodicity of the vocal folds, of the mucosal waves. And next slide, please. So there was an observable improvement in all the video stroboscopic parameters, including the glottic closure, mucosal wave amplitude, periodicity, and the symmetry. In the pre-treatment and post-treatment, all the values had a significant improvement. Next slide, please. All the patients showed incomplete closure with an hourglass pattern found most commonly, which improved after the treatment in 68 cases and sustained in the 17 cases. A focal absence of mucosal wave was seen in 32 cases, which reduced to 7. Mucosal wave asymmetry was observed in 44 cases, which reduced to 12 cases after treatment. The periodicity of the mucosal wave was deviated from normal in 53 cases and was sustained in 9. The amplitude of mucosal wave was observed to be deviated from normal in 46 cases, which remained in 8 cases after the treatment. Next slide, please. So in the present study, we observed a male preponderance with a male to female ratio of 1.65, which was corresponding to other studies of Hegde et al. And Shrestha. We observed most of the cases belong to the age group between 31 to 40 years. Similar age distribution was seen in the study of Hegde et al. And Hassan et al. In our study, 62 out of 85 cases accepted the having a history of vocal abuse, which was also seen in the study by the Nirukar et al. Next slide, please. 42 cases were smokers, and most common lesion was in the vocal fold nodules, which was in competence with the Haringwani and the Ardani studies. In the present study, the most common site of lesion was found to be in the anterior 1/3. Diffuse involvement was observed in 15, and posterior third was affected only in 3. The Haringwanvati and the Ardani also observed the lesions most commonly in the anterior 1/3. Next slide, please. So this study shows that the video stroboscopy is a reliable method of early diagnosis, identification of the benign vocal fold lesions, and assessment of the results of the treatment. Simple methods of voice analysis help in the assessment. An observation of both video stroboscopy and voice assessment can be explained to the patients. It helps in the understanding of their issues and improvement over the course of treatment. This understanding also helps them to follow up, practicing the voice therapy and improving the lifestyle changes. Next slide, please. The study shows the positive outcomes on all the observable parameters after adequate standard treatment. It can be concluded that the modern treatment of these lesions, they start with proper diagnosis, include prior counseling, pre-operative and post-operative voice therapy, guidance, and voice analysis at various steps till the previously set achievable goal is met. Cold knife video-assisted microlaryngeal surgery remains a cost-effective as well as an efficient method for the treatment of the lesions. Including adequate voice therapy is important for the improvement of voice. Next slide, please. So the clinical significance of our study indicates that the strategy of treatment of the benign lesion should focus on both the cure of the lesion and acquiring a better voice quality. Voice therapy helps in the important role in the treatment of benign vocal fold lesions. Video stroboscopy and voice analysis are helpful in diagnosis and follow-up. The size of the study is small, so the limitation in the terms of the number of cases included is there. A larger study may give the more validity to the conclusions. And we also had the limitations in the name of compliance of the patients for voice therapy and suggested lifestyle changes was variable. So this has an impact on the results of the study. These are my references. And thank you.
Thank you, Dr. Aparaajita, for a wonderful talk.
Thank you.
Are there any questions for